Today, we're tackling a critical topic that could literally save your life: stroke warning signs that can show up a whole month before a stroke hits. Cardiovascular diseases are on the rise globally, including among the younger population. This is undoubtedly the leading cause of death. In the United States, where every year more than 795,000 people suffer a stroke, and stroke kills nearly 159,000 Americans each year. Strokes are serious medical emergencies. The sooner they're caught, the better the chance of minimizing brain damage and getting back on your feet. So, throughout this video, we'll be exploring 7 important signs that could appear a month before a stroke. Symptom number 1, silent high blood pressure. This might sound scary, but silent here means there might not be any noticeable symptoms. Blood pressure measures the force exerted by blood against our artery walls. When this pressure escalates, known as hypertension, it poses significant health risks. This elevated pressure can cause damage to the blood vessels, leading to narrowing, weakening, or even rupture over time. However, chronically high blood pressure significantly increases your risk of stroke. If you haven't had your blood pressure checked recently, schedule an appointment with your doctor. It's a simple test that could save your life. Symptom number 2, extreme fatigue. Feeling unusually tired all the time, even when you haven't exerted yourself and are getting enough sleep, could be a red flag. It's important to remember that fatigue can also have other causes. If you're experiencing intense, persistent tiredness that may be atypical for you and is not related to physical exertion or lack of sleep, it could be an alarm. This excessive tiredness may be related to changes in blood flow to the brain. It can be due to a narrowing of an artery due to atherosclerosis or a possible clot there, which interferes with the supply of oxygen. So if you're feeling an abnormal level of tiredness, seeking medical evaluation is crucial. Symptom number 3, vision problems. Sudden changes in your vision, like blurry vision, double vision, or difficulty focusing, can indicate problems with circulation in the brain. Don't ignore these changes. They could be a warning sign of an impending stroke. While there are various causes for vision problems, it's crucial not to overlook these symptoms. Vision loss may result from the blockage of an artery supplying blood to the eye, often indicating an ischemic stroke, the most common stroke type, so it's essential to take such changes seriously and seek medical evaluation promptly. Symptom number 4, sudden severe headache. A new intense headache, especially with hemorrhagic strokes, where bleeding occurs in the brain, can be a warning sign. Within the brain, the intense headaches result from increased intracranial pressure due to the bleeding elevating brain pressure. Witnesses of stroke incidents often report seeing the affected person clutching their head, displaying an expression of intense pain, followed by a loss of consciousness. This reaction is particularly common in hemorrhagic strokes, where the headache experienced is frequently described as the most severe in the person's life. Sometimes a severe headache could also indicate an imminent risk of an aneurysm rupture within the brain. If you experience a sudden and severe headache that's unlike anything you've had before, seek medical attention immediately. Symptom number 5, numbness or weakness. Sudden numbness or weakness, especially on one side of the body part, like an arm, leg, or one side of the face, can be a symptom of a TIA, transient ischemic attack, which is like a temporary stroke. While the symptoms typically disappear within 24 hours, a TIA serves as a crucial warning that a full-blown stroke could be on the horizon. They should never be overlooked, regardless of whether they signal a stroke or another neurological issue. Immediate medical investigation is essential. Symptom number 6, speech difficulties. Slurred speech, trouble forming words, or complete sentences are categorized under aphasia, defined as the impairment in understanding, formulating, and expressing speech. This could indicate an impending stroke. If you suddenly find yourself struggling to speak clearly, don't hesitate to call emergency services or have someone take you to the hospital right away. Symptom number 7, neurological problems. Issues with memory, balance, nausea, and vomiting might appear days or even weeks before a stroke. While these symptoms can also be caused by other conditions such as migraines, seizures, hypoglycemia, encephalitis, brain tumors, anxiety attacks, and infections in the central nervous system, it's important to get checked out by a doctor, especially if they appear suddenly and persist. Now, let's delve a little deeper into the two main types of strokes, ischemic and hemorrhagic. Ischemic stroke, blockage. This is the most common type of stroke, accounting for about 85% of all cases. It happens when a blood clot or plaque buildup blocks blood flow to part of the brain. Imagine a clogged pipe. That's what's happening to the blood vessels in your brain. Hemorrhagic stroke, bleeding. This type of stroke occurs when a blood vessel in the brain bursts, causing bleeding within the brain tissue. Think of a burst pipe flooding the room. The leaked blood puts pressure on the surrounding brain cells, causing damage. Understanding the difference between these two types of strokes can help doctors determine the best course of treatment. There's another potential threat lurking in the shadows: brain aneurysms. These are weak bulges in brain arteries that can rupture and cause hemorrhagic strokes. Often they don't cause any symptoms, but they might be detected if you have a family history of aneurysms. Screening, especially for those at higher risk, is crucial for early detection. The good news is that stroke is largely preventable. By adopting a healthy lifestyle and managing certain health conditions, you can significantly reduce your risk. Here are some key strategies. Manage blood pressure. As we discussed earlier, high blood pressure is a major risk factor for stroke. Work with your doctor to create a plan to keep your blood pressure under control, which might involve medication and lifestyle changes. Control blood sugar, if diabetic. If you have diabetes, it's essential to manage your blood sugar levels carefully. High blood sugar can damage blood vessels and increase stroke risk. Maintain a healthy weight. Being overweight or obese increases your risk of various health problems, including stroke. Aim for a healthy weight through a balanced diet and regular exercise. Exercise regularly. Aim for at least 150 minutes of moderate intensity exercise per week. Physical activity helps improve blood flow, lowers blood pressure, and strengthens your overall health. Eat a healthy diet. Focus on a diet rich in fruits, vegetables, and whole grains. Limit processed foods, sugary drinks, saturated fats, and excessive salt. A healthy diet contributes to overall well-being and reduces stroke risk. Quit smoking. Smoking damages blood vessels and significantly increases stroke risk. If you smoke, quitting is one of the best things you can do for your health. Get enough sleep. Aim for 7 to 8 hours of quality sleep each night. Chronic sleep deprivation can contribute to various health issues, including stroke. Manage cholesterol levels. High cholesterol can lead to plaque buildup in arteries, increasing stroke risk. Work with your doctor to manage cholesterol levels through diet, exercise, and medication if necessary. Schedule regular checkups with your doctor. Regular checkups allow your doctor to monitor your health and identify any potential risk factors for stroke early on. Don't skip your checkups. Did you know about these pre-stroke symptoms? Share your thoughts and experiences in the comments below. Let's create a conversation about stroke awareness and empower each other to live healthier lives. If you found this video informative, give it a thumbs up. Sharing is caring, so spread the word to your loved ones. Don't forget to subscribe to our channel for more health content, and hit the notification bell to stay updated on our latest videos. Thanks for watching. Remember, early detection is key. Be vigilant, take care of yourself, and see you next time.